Welcome to my world, another day, another time for knowledge acquisition. Knowledge is power, health is wealth. Today's topic has to do with testicular cancer diagnosis. When you talk about the testicles, you are talking about the male gonads, the male organs for reproduction. Without the testicle, there can be no conception. So when the testicle is now experiencing something abnormal that finally may become a cancer, because that is what it is, not a very common cancer anyway, but it does happen. But how do you differentiate the testicular cancer from other abnormalities of the testes? That is what I want to really help, especially with laboratory diagnosis. So if you like my presentation, press the like button, subscribe, and surely more quality production will come from me. The objective: to create more awareness of testicular cancer, its differentiation, and the medical laboratory diagnosis necessary for effective treatment or cure of the disease. Introduction: testicular cancer is a disease in which malignant cells form in the tissue of one or both testicles. It occurs in the testes located inside the scrotum. The rates are highest in northern Europe and America, but lowest in Asia and Africa, and intermediate in Central and South America. This is one of the lucky situations where Africa is exempted or partially exempted. The most common type of testicular cancer, that is 95% of several occasions, is germ cell testicular cancer, the cell involved in sperm cell production. The two main types of testicular cancer are the seminoma type and the non-seminoma. These tumors, the seminoma tumors, are usually slow growing and are most common in men between the ages of 30 and 50. So it is something you talk about adults. You can find it in adults. They tend to respond well to treatment and have a high cure rate. But the other one, non-seminoma, is in younger people, children. These tumors are more aggressive than seminomas and may contain several different types of cells. They typically occur in younger men and may require more aggressive treatment. The non-seminoma tumors can further be classified into different subtypes: teratoma, embryonal carcinoma, choriocarcinoma, HCG when you talk of around the breast, and the yolk sac tumor found in children and young adults. Symptoms: the first symptom of testicular cancer is the tumor. You find that lump, that's like when women are asked to always feed their breast, searching for the lumps, and that's the only preventive way of avoiding the testicular cancer, because early detection would mean early treatment and cure. So, but the other symptoms that could be found is discomfort, pain, or a feeling of heaviness in the scrotum. Pain in the lower back too, or abdomen, is part of it. Enlargement or increased sensitivity of the breast is also something you should know. Then collection of fluid in the scrotum. When you feel your scrotum and you cannot feel the testes, the testicles, you cannot feel it, a sudden onset of hydrosis could indicate testicular cancer. Cancer stages. When you talk of cancer stages, you just want to believe that it's a gradual decline in health to death. But with testicular cancer, it seems at any stage, you are still very high hope for cure. But the best is to detect it very early. And so within a year, you are off it. Stage 1, the cancer is confined to the testicle and has not spread to any lymph node or distant organ. It is split into stage 1 and stage 1B, 1A, 1B, depending on the size of the tumor. Stage 1S means you have raised level of markers in your blood after surgery. That is, the tumor markers are raised. Stage 2, the cancer has spread to nearby lymph nodes in the abdomen, pelvis, or retroperitoneum, the area at the back of the abdomen behind the intestine. You can always notice also the back pain. Then the final stage, stage 3, the cancer has spread to distant organs such as the lung, liver, or even the brain. So there are still chances that one could cure this testicular cancer even at the third stage 3. Finally, laboratory diagnosis. There are 3 types of tumor marker blood tests. When you talk of marker tests, it's usually very common with cancer investigation. The 3 tumor markers are the alpha fetoprotein AFP, the human chorionic gonadotrophin HCG, also common when you do pregnancy tests, and lactate dehydrogenase LDH. Elevated level of these markers can indicate the presence of cancer and may help monitor the effectiveness of treatment. So if there is improved treatment, the levels will reduce gradually back to normal. You can also collect the biopsy, that is the sample of the tumor, and they're very useful in histology or cytology to study it. The scrotal or the ultrasound could also be very, very useful. So all that I have tried to do with this slide and many slides on health matters is to create the necessary awareness so that you can always be aware of what is wrong with you. Just like with breast cancers, that people have to examine themselves. If you examine yourself and you notice any of these things, you know how to meet your clinicians or even perform some laboratory investigation. So if you like my slide, always patronize. Check many more videos on my channels.